People tend to mention women when they talk about cosmetic surgery, but certainly we're seeing a far greater proportion of men coming for cosmetic surgery. And what procedures do men have? Well, they have all the same procedures as females usually. They may come for liposuction, they may come for abdominoplasty, especially with massive weight loss patients. They may come for facelifts or neck lifts more commonly. They may have their eyelids, which are starting to affect their fields of vision. Men will come for fillers and injectables to try and for that maintenance and prevention of stigmata of ageing. So we see them basically for all the same procedures as we'd see a female for. The one unique procedure, of course, we see males commonly for is gynecomastia or male breasts. It's a condition which can be quite debilitating for a male who's not happy to take his shirt off at a beach, not happy to take his shirt off in a football change room, just embarrassed or stirred, teased by his mates at golf or sport or etc., or even his kids around the swimming pool. So certainly we see a very large number of patients with gynecomastia. I think males being males don't like to talk too much about these things. It's not the sort of thing you go and tell your mate you've had your man boobs removed and stuff. I think a lot of patients would be shocked at how common it is and how many we actually do. With gynecomastia, there's really two ways of treating it to some respect. The traditional way was with an incision around the edge of the areola and you physically remove the tissue. That usually requires a drain and a period of recovery. The technique I use more commonly now, which has been a great innovation I think in my practice, is a combination of called liposuction and avulsion of the gland. With that I'm able to make incisions remote from the nipple, so they're down on the chest, they're asymmetrical, so they look just like mole excisions. So if someone asks what are those scars, the answer is, oh, there's a couple of moles removed. We liposuction the volume out of the breast, and then we're able to put some forceps tips and actually physically avulse or remove the glandular tissue from under the breast. Correction of gynecomastia is a quick operation in many respects. It's quick recovery. It's usually almost exclusively done as day surgery. Most patients would be back to work, even with a physical job, in about a week. It is considered a medical procedure, so there are Medicare item numbers associated with it, and certainly if you're in a health fund, then a lot of the costs will be covered as part of that medical procedure. But it's an operation which I think is very good. I mean, it can change lifestyles again, from people who avoid going to the beach to people who are happy to go to the beach. Even to get down to a situation where people can just wear normal business shirts and not feel embarrassed and things. So it can make a very big, significant difference to people.